I actually decided to enter the field of medicine when I was a senior in college. I was planning to go on and pursue my PhD in psychology and go into counseling, and I took a class in psychobiology, and I kind of fell in love with the sciences, which I hadn't even thought about before. Then I went to med school at Tulane, and I did my master's in public health with my MD, so that I could do like a little more preventive medicine and alternative choices. So it worked out well. The things that I truly enjoy the very most about women's medicine would be just the long-term patient interaction. You know, be with patients from the time that they first come in, and then maybe they'll get married and then have children, and then to watch the kids grow up and to continue that relationship. It's pretty incredible. The most challenging aspect of my job is truly our 24-hour call, where we work 24 straight hours. It used to actually be 72 straight hours, and then over the years it's down to 24, but they're very, very busy 24 hours. So a lot of incredible things happen in that time. The most memorable patient to me over 20 years initially started out very sad. It was a sweet young patient who was pregnant with her first child and had what we called an intrauterine fetal demise. Actually, when the little baby dies in utero, this was due to an umbilical cord around the neck. And so we had to go on to deliver with the whole entire delivery, and then without a little baby to take home. She was there with her amazing husband and her 4 older brothers and her mom and dad, the most supportive and loving and faithful family I've ever met. So from that amazingly sorrowful time, we then went on to deliver 3 wonderful kids and to be a part of that through each pregnancy and to watch the family. And I think that would probably be it. If I would describe myself, I would probably say I was compassionate, enthusiastic, and energetic. The way I stay current in medicine now is through several different avenues. I attend conferences, and then we actually keep our board certification through reviewing a series of articles that is given to us by the American board. And so we will read those and then answer the questions. And those are actually the most up-to-date articles that the board thinks is very important for us to know. So we go through those, and then very often the partners will talk about it, because most of us actually keep our board certification in that way. In my spare time, I spent it mostly with my family. I have 3 children, and my husband and I are very active in their lives. And between the sports and traveling and taking care of them, it's quite a balance to keep both medicine and the family together. I love our Orange Coast Women's Medical Group. We have an incredible group of physicians, very different, very unique personalities. But we're like a big family. And I think that's awesome. So people can come to our group and can choose from many, many different personalities, different backgrounds, male, female. I think that's wonderful. And we now have just a very lovely, almost a women's center with our aesthetic center. And we have estheticians, we have laser center, we have a nutritionist. So there's just, we try to really touch the different areas of women's health. And I think that's incredible.